Good morning, Vicky. My name is Danielle and I will be your nurse today. You will be undergoing a Mohs surgery, which is a technique used to treat skin cancer, like basal cell carcinoma, the one, the type of cancer you have. It is a type of cancer that starts in the top layer of the skin, grows very slowly, and rarely spreads. The goal of this surgery is to remove as much of your skin cancer as possible while doing minimal damage to surrounding healthy tissue and leaving the smallest possible scar tissue. The surgery will be performed by a dermatologist well trained in Mohs surgery called Dr. Lee. So do not be scared, everything will be fine. Before starting the surgery, the surgeon, which is Dr. Lee, will inject you a local anesthesia to minimize pain. So relax, you will be okay. The procedure is done in stages and you will be waiting between each stage. Using a scalpel, Dr. Lee will remove the thinnest possible layer of visible cancerous tissue. Then I will bandage your wound and take you to the waiting area while Dr. Lee examines the tissue under a microscope in the lab. If she finds out that any cancer cell remain, I will call you back to the operating room so that she can remove another layer of tissue while sparing as much healthy tissue as possible. Dr. Lee will repeat this process until no cancer cell remain. At the end of the surgery, she will close your surgical excision with stitches that will need to be removed later. The procedure may take 3 hours or the whole day depending on how it goes. Just be patient. We will take a good care of you. You can expect minimal pain, minimal discomfort after the surgery, but pain can be managed well with acetaminophen, which is commonly called Tylenol. So, if you have significant discomfort, report it immediately to us. Vicky, keep in mind that you need to be very careful with your wound when staying home. You must keep your wound area dry for at least 1 day after the surgery to reduce the risk of infection and avoid any activity that could cause it to reopen. Also, avoid sun exposure to minimize scars. Do not forget to take your medication. Please take your medication. Now, let's schedule your follow-up. You will have to come back in 2 weeks' time to have your stitches removed. What day works best for you? What did you say? March 5th? Okay. Tuesday, March 5th. Great. I have your appointment written down for this date. It was a pleasure being your nurse today, Vicky. Take care of yourself and see you soon. Bye.